Hi, I'm Jack Andrejka with The Scoop, and we're here with the Stanford MedX e-Patient Advisory Board Chair, Nick Dawson, who has done some amazing work in terms of social media and patient care. So tell us a bit about your work.
Well, first of all, I ought to probably acknowledge that I don't think we have a chair. We have kind of a conglomerate of people who all work together. But social media has really become this thing where it is the place to have a virtual meeting of the minds, and it's a place where everybody has an equal voice. And so I see that as a very powerful equalizer and leveler. And we've almost moved past it to the point where it's not special to be on social media anymore, especially if you're a patient or somebody who's really involved in participatory medicine. It's just a default. It is a thing that we do. It's how we communicate.
Now, how did you get interested in participatory medicine?
I was working in healthcare in hospital administration and had a very traditional leadership role, and was online for my personal life, and very quickly realized that there were groups of patients who were talking about our hospital and wanted to talk with us, and nobody was answering back, and had some experiences that involved going to meet patients in the emergency room or in the care setting when they said, "I've got a problem." And it was profoundly transformative. It was the experience of having somebody say, why do you do it this way?
Yeah.
And why can't it be different? And for us to say, for me to have the realization that we had been doing things we thought were very patient-centered designed, but they really weren't, because we had never asked them. And then, of course, social media gives us this opportunity to ask and involve and pull in, but we've really gotten to the point now where we need to bring patients in physically to the design process too.
Yeah, and so I heard that you were also partnering with IDEO here on a workshop. So tell us a bit about that experience.
Yeah, so for the third year, Medicine X has been part of, or has had IDEO as a partner to conduct the patient-centered design workshop. So about 60 folks, maybe 40 folks come together. We divide up into teams. There's 5 e-patients. The patients bring their own challenges with them, and the teams then work along with IDEO coaches using the IDEO methodology to literally design new things. And sometimes that's a product, and sometimes it's a service, and sometimes it's an app, and sometimes it's a process around those patients' needs. And we say this every year, and it's really hard to conceptualize, but it is truly magical because something comes out. It's amazing.
Wow. And so what's the most exciting thing that's happening right now in participatory medicine?
Without a doubt, it is. We've moved past the argument. The pendulum. We went really, really far, and we said patients have rights, and we demand to be at the center, and we demand equal footing. And a whole group of healthcare professionals said, yes, we agree. And so the pendulum has kind of swung back to the middle, and now we're in this cooperation phase, this doing phase, and it's incredible because the momentum is there and everybody is working together, and so it's really this period of action, and that's just amazing to watch.
Awesome. Well, thank you so much for taking the time to speak with us.
Glad to do it. Good to see you.
Awesome. For The Scoop, I'm Jack Andrejka.